With them being taken away, it's going to affect us quite a bit. It'll make our insurance probably be at least $3,000 a month. There's no way. That's going to take all of my husband and I's income, and we are in our 60s. We're going to have to work harder just to get through and be able to survive.
Beautiful.
Working harder is not going to help you. I'm sorry to say this, but this is not the economy where you're going to work hard and survive. This is the economy where you have to work smart and survive. $3,000? That's how much she's going to have to pay for health insurance. That's crazy.
Bill Medicaid cuts. I'm for it because I'm an able-bodied American citizen right now. I'm headed to work. I work at least 40 hours a week. People need to stop just getting free benefits. If you can go to work, you need to go to work because we're tired of paying for everybody. So Medicaid cuts, we're here for it.
Here's my mother-in-law. She worked 40 hours a week too at the same company for 32 years, and she was union, and then she got brain tumors and she lost her health insurance because if you're not working, you're gonna lose your health insurance, and then Medicaid and Medicare kick in. Every single person is one tragedy away from having to be on Medicaid and Medicare. You're one brain tumor, one car accident, and for you specifically, looking at you, I can tell you're one heart attack away from needing Medicaid and Medicare. Now, I know that you think everybody that's on them is lazy illegals, but guess what? One day, you're gonna need it and you're not gonna have it. And it's not you that's paying everything. It's people like me, the younger generation, that are paying for that for you.
And guess what? The younger generation is getting smaller and smaller in size. People are not having kids anymore. So if people are not having kids anymore, and the people that are alive are getting older, where's the money going to come from? If the population of Gen Zers, by the way, Gen Zers is the smallest population, even smaller than the baby boomers. And the baby boomers are so many of them. Who's going to take care of them? And by the way, don't forget to subscribe and like this channel, August Reacts. This is one of my favorite channels now. This lady's doing great work. Please go subscribe to her channel.
For her. Now, thank God that she has successful children that can subsidize her way of life, because Medicare and Medicaid, it don't cover it all. You're going to be in poverty forever, and you're going to lose your house, you're going to lose your home, you're going to lose everything that you ever worked for, and you're going to have to move in with your kids. So I hope that you have fucking rich kids, because you just made that little tiny entitlement that you're going to need fucking smaller. I would like people like you to think of the future. You're going to need it. For you, it's probably going to be a couple years, all right? Because I can tell you've probably been eating butter and fried chicken for the last 20 years.
America is no longer the greatest country in the world. Whatever lies that you guys have been fed for many years, you need to stop that. You need to, get rid of that mindset, guys. This place is a trap. But you have to operate differently now. Now that you have all this information, your mindset needs to change. You need to adjust. Don't cry about it. You need to just adjust to the new era that we're in. Because we're in a completely different era. If you're still operating as if it was 2023, 2020, you're already behind the 8 ball. You're already so far behind, it's not even fair.
What a beautiful morning. So grateful that Trump got in office. Life is going to be so much easier again.
A few moments later.
So I just got the quote from the dentist in Mexico I've been looking to go see, because no offense to my current dentist in the United States, I love him. He does a really great job, and I wish I could go to him. I just can't afford dental care in the United States.
Own the libs. Are you winning yet? No, because you played yourself. These are the females who lack the spine and the courage to step into a private voting booth and vote to safeguard their own rights as women. They're so weak that they actively participate in their own downfall, allowing men to use them as tools to strip away their own rights and help strip away the rights of us all as women. This is what happens when you're gullible enough to fall for the conservative patriarchal illusion of a traditional family, where the man is supposed to be the leader, but in reality, that so-called provider is a failure, leaving you, his wife, so financially helpless that you are forced to rely on the very people that y'all demonize and cheer to be deported just to survive. Now look at you crossing the border into Mexico. Yes, the same Mexico you clutch your pearls over just to be able to afford health care. You're out here bragging about voting for Trump, yet you can't even afford to put America first under Trump. You're out here fighting for white supremacy, but white supremacy ain't fighting for you. Make it make sense. And the best part, this is just a warm-up, so buckle up because the real struggle hasn't even started yet.
My health insurance just went from $1,150 a month for my wife and 18-month-old son and myself to $2,100 a month for my small family. That is an extra $1,000 a month, $600 a week I have to pay. That's covering nothing. After that, it's 50% ER visits, co-pays, pharmaceutical cost. This is absolute insanity. And
I think people are starting to wake up to the reality that this whole thing is a scam. Health insurance is a scam. So people are just going to stop paying. I told you. People are going to stop paying their premiums. And, we're going to operate like we're in Africa. This is how we operate in Africa. Most people here, they don't have health insurance in Africa. They don't. They just go to the hospital, pay out of pocket. Very few people have health insurance.
the system is beyond repair.
A woman in Texas has stage 3 cancer. Her name is Joanna Scott. She just found out her health insurance premium went up over 700%. 700%. Her monthly premium jumped from about $200 to $1,725 for the exact same plan. Joanna makes $1,200 a month. Do the math. And if she somehow paid for it, she'd have zero money left for food, zero for rent, zero for utilities. Her cancer treatments cost between $20,000 and $45,000 per session.
$20,000 and $45,000. This is how much Medicare and Medicaid was paying for her treatment. It's insane. Now I see why the Republicans are trying to cut all this stuff. I'm not saying it's right, but I'm saying, just think about that. $20,000. And the thing is, these health insurance are the biggest beneficiaries of all this. These hospitals are the biggest beneficiaries of all this. This is why the CEOs of these hospitals, of these facilities, they're millionaires now. They're rich.
One session costs more than her entire yearly income. She needs treatment regularly for the next 2 years. And she said this, and I need you to hear it. If I don't have my insurance, I am going to die this year. That's a death sentence written in billing statements. And why did this happen? Because Congress let Affordable Care Act subsidies expire. Subsidies that helped over 20 million Americans afford health insurance. They worked. They saved lives. And now people like Joanna are at home staring at numbers that decide whether they live or die. She says she's been crying since December, not because of the cancer, because of the insurance. Democrats tried to make the help permanent. Republicans blocked it over spending concerns. Congress is back now. There's talk of a bill. A few Republicans might help pass it in the House. But even if that happens, it could die in the Senate or get vetoed. So right now, today, millions of Americans are trapped. But ask yourself how many people have to say I'm going to die before anyone actually does something.
For $20,000 per session for this treatment, it's cheaper to just fly to Mexico every weekend to get this treatment for maybe $1,000. It's crazy. It's crazy. This whole medical system in the United States is a joke. Complete joke. I had malaria a few days ago. Well, I still got a little bit of it now. I went to the hospital here in Africa. VIP treatment, I paid $45. $45 for VIP treatment. I got to see a real doctor. I got to, get my vitals checked, blood work and everything. Got my medication. Medication was a couple of dollars, I think $2 or $3. That was it. Now I'm feeling better. I couldn't even imagine if I felt that sick, if I got malaria, let's say in Atlanta, You know, how much that will cost me? That'll probably cost me like 10 times what I paid here. It's crazy.
Because Joanna doesn't have time for another later this year. She needs help now. And silence is choosing who gets to live.
Did you guys see that woman talking about her father getting kicked out of the nursing home? Well, apparently the nursing homes are kicking out their Medicare patients. And she was like, why would they do that? And everyone in the comments was like, honey, this is what you voted for. This is Medicare cuts. This is the big, beautiful bill. And she was like, no, that's not it. Yes, it is. I work in skilled nursing. 90% of the residents that are in there, they are Medicare patients.
90% are Medicare patients, guys. And she handles those cases. She knows what's coming. She knows. Let's listen.
These buildings stay open because of Medicare. They will close down. They will not care for your aging parents and grandparents for free. They will send them home to you. You will have to quit your job and stay home and take care of them. That means you're going to have to be the caregiver for your father, your husband, your kids. You're going to have to quit your job. You're going to do all this on half the income for your household. This economy is going to suffer greatly when these places start closing down.
It's a cold world out here, guys. I'm not going to react to the entire video because I want you guys to go support August Reacts. But you just heard the lady. 90% are on Medicare. So if you guys are still dealing with patients that are on Medicare, you're going to be in big trouble. You're going to be out of work very soon. But don't worry, because there's a way out of this. There's a way out of this mess. You got to pivot right now before everybody catches on. Because by the time everybody catches on to what's happening, it's going to be too late. It's going to be too late. So you need to start pivoting now. Pivoting means that you need to start focusing on private paying clients. They're private paying clients that need these services, because they're not going to just completely stop needing service or needing caregivers. They're going to need caregivers. Healthcare is a need. So you need to start figuring out a way to attract these private paying clients that can afford your services. And I can teach you how to do that. But it starts by you investing in yourself, realizing that the game has changed. We're in 2026 now. This is the Trump economy, not the Biden economy. So you need to make those adjustments now. Put a link in the description of this video. Schedule some time. You're going to need a coach. You need somebody in your corner that can help you, make those changes. Don't wait until you get laid off. Once that facility that you're working at gets shut down, it might be too late. Schedule a call. I'll put a link in the description of this video. Start now. And then once you schedule a call, I'll add you to a private WhatsApp group. I already have a bunch of WhatsApp groups going on for different states. So schedule a call. Talk to you soon.